Hello, everyone, and welcome to Gruff Talk, where each week we take a deep dive into all the ways we can feel better, look better, live better, and age better. I'm your host, Barbara Hannah Grufferman. I transitioned to being a post-menopausal woman around when I turned 50, and I was completely unprepared for how it would impact my heart. I started to experience an irregular heartbeat along with feelings that my heart was jumping clear out of my body, especially when I was lying in bed at night. I never told my husband, thinking it would go away. It didn't. After one particularly scary episode, I landed in the ER, confessing all to my husband and doctor, and then made an appointment with a cardiologist. Diagnosis? Supraventricular tachycardia, SVT. It's a non-life-threatening heart issue that causes the heart to do exactly what I just described. And it's common in both men and women, but even more common in postmenopausal women like me. Who knew? After all the usual tests and lots of discussion, I was put on a mild calcium channel blocker and was told, okay, good luck running the next New York City Marathon, meaning I had zero restrictions put on my life. On the contrary, that's when I ramped up my workouts and reassessed how I was eating, sleeping, and managing stress. I vowed that day to never allow heart disease to be the cause of my premature demise. Nope. I'm sure I'm not alone. In fact, Oprah wrote an article in her own magazine about how doctors mistook her perimenopausal symptoms for heart disease. She wrote, "For 2 years, I didn't sleep well. Never a full night. No peace. Restlessness and heart palpitations were my steady companions at nightfall. I went to see a cardiologist, took medication, wore a heart monitor for weeks. She then learned that those palpitations were common for women her age, and then she wrote, but no one, including my trusted doctors, had warned me. And when my symptoms showed up, we looked for the most dire explanation, heart disease, instead of the most likely." So she took to her soundstage and aired multiple shows about it because no one else was talking about any of it at the time. She says, "Until that point in my adult life, I don't recall one serious conversation with another woman about what to expect when going through menopause. Sadly, menopause is still swept under the rug way too often, which is the main reason my guest today, Dr. Margaret Nachtigall, and I started Menopause Cheat Sheet newsletter in early 2020. Each month, we do an episode of Gruff Talk, which focuses on a different aspect of menopause. And today, it's all about how it affects your heart. I'm happy, as always, to be joined by Dr. Margaret Nachtigall, who is a reproductive endocrinologist at NYU Langone Health in New York City. She's a leading champion of women's health, especially women in midlife, and is the medical director of Menopause Cheat Sheet, the newsletter we publish together to help women navigate life before, during, and after menopause. It's free, and you could subscribe by going to www.menopausecheatsheet.com. Okay, we have a lot to talk about, so without skipping a beat, let's get on with the show. Hi, Dr. Margaret, and welcome back to Gruff Talk.
Hi, Barbara. Great to be here.
So we have a lot to talk about. It's all about the heart and menopause and how menopause affects the heart. So let's get right to it. Starting with, new research shows that menopause may not directly cause heart disease, but it can drive the risk factors. Can you please explain that?
Absolutely. I think basically how I would put it is that there was a great position statement that just came out from the North American Menopause Society in 2022. And it looks at all different aspects of hormone therapy and the risks and the benefits for people. And the section on cardiovascular disease is really interesting. And basically what it shows is that if hormone therapy is introduced early on, that there actually reduces the incidence of cardiovascular disease. And so with that, and with the absolute importance of timing and deciding that if you are going to initiate hormone therapy, that it should be done early. This fact is something that really makes us take a look at heart disease in general and should really be factored in when individuals are trying to make a decision on whether or not they should start hormone therapy. In other words, the timing is so critical.
Right. But this about the hot flashes, which is, a symptom, one of the biggest symptoms of
And so
menopause.
many symptoms.
What's the connection between hot flashes and heart disease or heart issues when a woman is going through menopause?
So that's a great, great point. And what has been found is that people that have hot flushes have a higher incidence of cardiovascular disease. Not only that, but the severity of the hot flash. So the more severe the hot flush, the less good the blood vessels are. So not only is it your number of hot flushes, but it's how severe your hot flushes is may correlate to an increase in cardiovascular disease. And interestingly, just as you said, other symptoms of menopause, such as difficulty sleeping, that also has been linked to a possibility of an increase in heart disease, because that disordered sleep can have all sorts of different effects on the human body. Although it's very hard to tease apart because people that are having a lot of hot flushes often have difficulty sleeping. So the two may be linked one and one. Interestingly, also depression, which is another one of the side effects or symptoms of menopause, has also been linked to more cardiovascular disease. So just as you said, that a lot of the symptoms that we attribute to menopause may also contribute to having an increase in heart disease. Now, that's not to say that one causes the other. It's just shown that there is an association.
Mm-hmm. And getting back to hormone therapy
Sure.
for a minute, and of course, its connection to protecting the heart as well as many other things like your bones and your brain and so on. We know that NAMS, the North American Menopause Society, did come out with a new position statement, which was also very clear, as you just stated, about its connection to heart health. But what else about that position statement that really had not only medical journals carrying the information about the position statement, but really the general media? I mean, it was a really big deal, and it just came out. Can you tell us more about that?
Well, it was a very exciting statement because it doesn't happen every year. And I think the big thing was that their position statement showed that both observational data as well as a reanalysis of older studies really showed, because they looked at the age of the individuals that were taking hormone therapy as well as the time from starting. And what they showed was, with all of these studies, including that very large study, the Women's Health Initiative, it suggested that for healthy women who are within 10 years of menopause, who are also having bothersome menopausal symptoms, that the benefits of hormone therapy outweighed the risks with fewer cardiovascular events in younger versus older women. So that was a big statement. That was sort of their major emphasis. But the key thing there is the timing. And I think, one of my, main points is that if people are considering hormone therapy, some people are worried about what are the risks, what are the benefits for them. And it's always really important to talk about the individual ones. But what we do know is the timing is essential. So if you're going to consider it, you want to consider it early and have this conversation as early as possible. And the other thing that this showed was that for many individuals starting hormone therapy, there are the main indications for hormone therapy in general. I should back up a minute here, are for hot flushes, for very severe vulvar or vaginal dryness or atrophy, right? Or for osteoporosis. Those are the main indications. However, now that we're seeing that there may be a benefit to cardiovascular disease, in the past, we've said don't start just for that reason. But now I might even predict that in 10 years, another indication may be because of this protection. But So far, we don't have that, but I think this is another reason to think about it.
Mm-hmm. It's something that I had considered, but not seriously at the time when I was going through menopause, because the terrible trifecta, as I call it, the mood swings, the hot flashes, the sleepless nights weren't so terrible for me enough for my then doctor to recommend to me. But now I do regret it, as I'm sure a lot of women do,
And I think
because I
that
have low bone
happens.
density, as you know, and I
Right,
talk about it, write
right,
about it a great
right,
deal.
right.
And I also, I experienced something called SVT, which is supraventricular tachycardia. It's a type of an irregular heartbeat that apparently is very common in postmenopausal women.
Mhm.
So, what are some of the other more common heart issues that women might confront, not will, but might, during the menopause journey?
Well, I think that you brought up so many things in that one statement that you just made that I think are so important to hit on. One is the fact that to think about what the risk factors were for you when you were starting and thinking about hormone therapy, and then that window closed for you
It
personally.
did.
So other people could take that to heart and say, okay, well, what are my personal risk factors for my future? And think about that. So that makes me think back to, okay, well, what are the risk factors and what should people be looking for to see if they are at an increased risk of heart disease, such as people that have abnormal lipid profiles. And that's so important. Looking at your cholesterol and the breakdown of your cholesterol. What is your total cholesterol? What is your HDL? What is your LDL? This is a very important component. And knowing what your lipid values are and what your cholesterol is can help determine if you are going to be at an increased risk for developing plaque or having disturbances within the blood vessels. So right there, that's a huge area for predicting heart disease. The other thing is weight. And we know that obesity is a setup for heart disease. So
Mm-hmm.
that's another factor. People that are smoking, increased blood pressure also is a risk factor for heart disease. People that are overly stressed or depressed, that's another risk factor. Inactivity. So the more active, less heart disease, more inactive, more heart disease. Menopause itself, just decreasing estrogen, is also a setup. And also critical is a family history. If an individual does know their family history, a family history of heart disease is also something that would make me raise my eyes and be concerned. And then other inflammatory conditions. So people that have chronic illnesses such as psoriasis or rheumatoid arthritis, other inflammatory conditions, that also increases the incidence of heart disease. So these are all reasons why it would make me suspect other conditions in menopause. And that will factor into whether or not you would be someone who might benefit from being on hormone therapy earlier rather than later.
And should women get baseline tests, even if they, for the heart
Mm-hmm, mm-hmm.
specifically, even if they are not considered at high risk, maybe don't have any of those risks you just mentioned, their
Right.
weight is okay, their cholesterol level seems to be fairly okay, but just because they're postmenopausal, should they be talking with a cardiologist about baseline tests
Right.
or what? What do you recommend to your patients who come in?
I think, first of all, lipids are a great screen. I think that every postmenopausal person or even nearing to be should know what their cholesterol levels are, and to get a fasting cholesterol level and your lipid profile. I think that talking to your internist, primary care physician, or caregiver is very important to be able to give a baseline. I am not a cardiologist, but I do absolutely, if anyone does have another risk factor for heart disease, would suggest getting, evaluated. One of the tests that's very nice is a test called the calcium score, which can allow you to look at the coronary artery vessels and see if there's any plaque that's there. But I would refer to the internist or for a person's healthcare provider to be able to determine whether that person should get any other tests other than the lipid values. And certainly anyone that has high cholesterol, I refer to get further evaluated. I mean, heart disease is the leading cause of death in women over the age of 65. And 1 in 9 women in the perimenopausal, in the 45 to 65 age group, will develop heart disease. That's a really high number. One
That's a high
half
number.
of all women over the age of 80 will develop heart disease.
One half.
One half over 80.
Mm-hmm.
And so it's
Dr. Margaret, would you say that the vast majority of the causes of all of these episodes of heart disease among women is controllable?
Oh, I mean, you're the best at this. I think because there are so many risk factors, there are some that are modifiable, such as smoking. Stop smoking. Don't drink that much alcohol. Get regular exercise. Eat well. Eat healthily. So absolutely, I think that there are modifiable risk factors that, things that we can do something about.
Yeah, we're going to talk more about that in a minute.
I know you're a big proponent.
Oh, huge. Oh, yeah. No, everybody knows that. A big, big, big. We're going to get more into that and go into deeper detail about all the things that we can do, everyone. But first, people ask me this a lot on social media, and when they send in the questions to you, Dr. Margaret, for our Menopause Cheat Sheet newsletter, for your column, Ask Dr. Margaret, they want to know about long COVID. We've been reading a lot of articles about how long COVID has contributed to cardiovascular issues in people, men and women. And we've also read studies that estrogen has helped women survive COVID. When they were doing a comparison between, the deaths of men versus the deaths of women, certainly in the beginning, like the first 2 years of COVID, it was really interesting to see some of those studies. But what's the latest update on COVID, long COVID, and women and estrogen and heart health? Anything? Or is it still just all being studied?
I'm not an expert in COVID, but I do think that there's some really interesting, as you mentioned, research looking at estrogen and that there may be a protective effect. Not to say that you should take estrogen once you have COVID because you'll do better, but it seems that people that were on estrogen during the time that they did get COVID may have performed better than those that weren't. But, there's not a control group for that really, because it may be that the people that were on estrogen were people who were seeing doctors more regularly. They may have been more healthy to begin with. So it's hard to say whether it was the estrogen itself or not, but it did seem that women tend to do better than men. We did see that, and we did see that people on estrogen tended to do better. But you really asked about the long COVID, which is really interesting because they're people who have had COVID. We know that COVID can increase clotting factors and more blood clots. We know that long COVID can produce difficulties with high blood pressure and low blood pressure and intolerability to change in, for instance, standing up can cause some dizziness and abnormal blood pressure changes. So there are a lot of changes that we're seeing with COVID and long COVID now. Hopefully, the people that are studying this more regularly are really going to hone in on what we can do to help people who are suffering with long COVID, because it is so prevalent and so many people are being affected by this. So I do hope that people can give us some answers.
Okay, after this short break, we'll talk about some of the best things you can do to take better care of your heart. Stay tuned. Okay, we're back with Dr. Margaret Nachtigall for our monthly menopause cheat sheet update. And today we're talking about how menopause can sometimes mess around with your heart. Okay, Dr. Margaret, it's clear, as we've said before, and so many times in many different formats, it's clear that heart disease is still a huge threat to women's ability to age better. In fact, it remains the number one cause of death of women. For sure, one of the best defenses is to do everything you can to mitigate the risks, right? What are those things women should be doing to take better care of their hearts?
Well, my feeling on that is to exercise regularly, eat well, try to sleep well, try to reduce stress, decrease inflammation. Those are the main factors. My favorite is not smoking and not drinking too much. In addition to all of those really important things, getting exercise, eating well, having a good regular schedule so that you can sleep. One of the things that we talked about in the beginning of our conversation today is, should women try to alleviate the symptoms of menopause, and would that be beneficial in terms of heart disease? And the studies from the reanalysis of the WHI, the Women's Health Initiative, really showed that if hormone therapy is given early, certainly in the first 10 years after menopause, but I like to say even 5 years, that people who took estrogen during that period of time had about a 40% reduction in coronary artery disease. So in someone that does not have a high chance of having a blood clot and who is having hot flushes, it actually may be beneficial to add estrogen. We know that estrogen has some negative effects in terms of increased weight in the middle. And we know that increased weight in the middle has a negative effect on cardiovascular disease.
Mm-hmm.
So it's certainly possible that by taking some estrogen and decreasing the likelihood of developing diabetes and insulin resistance, that may be beneficial as well. So I think that I would add that to my regimen for the right individual. It's very hard to say, in a program where you don't know who is listening, because it might be the absolute wrong thing for one individual. But I think as part of being healthy and doing the most that you can do for yourself would be to investigate to see if this would be additive and informative and helpful for you.
Absolutely. And as you and I always say, menopause is universal because it will happen. It will happen. I mean, when it happens to you as an individual really depends on what's going on, but it will happen. And so it's universal, but very personal. And not only is the experience personal, but the treatment must be personal because we're all different. So to your point, you have to look at the risk factors and your history and your mom's history, your dad's history, and what's going on in your life. And one thing too, I just want to go back to something that you mentioned as a healthy living tip. Sleep is just so fascinating to me, because when I talked about it at length in a recent episode of Gruff Talk, where I was talking about some new research about how you just cannot catch up. You can't catch up on a weekend. You have to get the sleep consistently every single day, 7 to 9 hours of sleep every night. I know the vast majority of us aren't, but it's a shame because good quality sleep and enough of it will actually help in so many ways. Your heart, actually your weight, as we now know, certainly your brain. I mean, for sure, that is now true. And just so many other ways. Your immune system. I can't say enough things about the importance of sleep in overall health and wellness. I just wanted to get that little public service announcement out.
But it's very interesting about sleep because there are so many different factors that can affect sleep. And sleep is so related to so many other factors.
Yes.
And one thing that many people don't realize is that sleep can start being disrupted because of a decrease in estrogen even before menopause. It's one of the symptoms that can occur in perimenopause. So even when periods are still happening, often they're becoming a little bit irregular, but sleep can be one of the first signs of impending menopause. And certainly in menopause, many people are affected by having disrupted or difficulty sleeping. The most common symptom is a difficulty in falling asleep. It's called the sleep latency from the time you put your head down to the pillow to the time that you fall asleep. And this lengthens with a decrease in estrogen. And estrogen restoration can often improve sleep tremendously. So that's just another component of your sleep health and your sleep hygiene, is that in some individuals, having some estrogen may be beneficial.
Oh, yeah, the importance of sleep. I'm planning on devoting an entire episode coming up of Gruff Talk to sleep and all the ways that you can get more of it. So stay tuned on that.
I definitely do not get enough of it.
No, you're way too busy taking care of all your patients. I know that. I sometimes check in with you at a time when you should be winding down at night and you are returning phone calls or writing papers or marking notes because you're also with your students. What can I say about you? But yes, at least you know about it and you're telling others about it. So that's a good start. Dr. Morgan, of course, as always, this was a terrific conversation about a very important topic. Please give us, what are your 3 essential takeaways from today's episode of Gruff Talk that you want everyone to remember?
Well, I think one that you just mentioned, which is modify those risk factors for cardiovascular disease. Cardiovascular disease is a serious problem, and try to reverse those risk factors. So eat healthily, sleep well, get exercise, and don't smoke. And then I think...
And manage stress.
And manage stress. Thanks for adding that in. Yep. Absolutely. And then I think my point is estrogen is not right for everyone, but it is right for many individuals. And I think to have the conversation about what your risk factors are and what your symptoms are, because individual, we say that all the time, but everyone's symptoms going through menopause are very different. Some people have tremendous hot flushes. Some people have moodiness. Some people have trouble sleeping, and some people have all of the above and then some more. But to discuss with a healthcare provider about what are your particular risks and what would be the potential benefit for you, and to have that conversation early when you are entering menopause, because of what we've learned now, where the timing is so critical. And if you start early, there may be some significant benefits for you. That just have the conversation so that you're not 10 years later and then can't start hormone therapy. So I think my messages are, to stay healthy, be well, but also to entertain the thought and the conversation in case this is something that really would benefit you, because I know that it'll help the symptoms. It estrogen reverses hot flushes, moodiness, sleep, helps you sleep, even helps you get rid of wrinkles. Or prevent
it sounds so good. I so regret I didn't take it.
So anyway,
every time I hear that part, especially the wrinkles.
My message is just to have the conversation and just look into your health.
That's right.
And take some.
Be open-minded. Be open-minded.
I think just to see a doctor and think about your health, but most importantly, what you always say, and you're a huge proponent of healthy living. So, and find some happiness.
Yep. Thank you for the time. Dr. Margaret will be back again next month with another episode of Menopause Cheat Sheet on Gruff Talk. And thank you, everyone, for tuning in. We love you all, and we want you to thrive and be well and have fun and age better than any generation before us, right? But no one can do that for you. Nope. You need to do the heavy lifting. We each need to take personal responsibility for how we live our lives starting right now. And listen, if you fall off that age better wagon, it's okay. Get back on. Don't stay off. Do not stay off, because we know and you know You can do it. Thank you. Thanks for tuning in, everyone. If you enjoyed this episode of Gruff Talk, please do 2 things. First, share it with all your friends and family, and subscribe to Gruff Talk wherever you listen to podcasts, including YouTube, so you never miss a single episode. Until next time, remember this: we can't control getting older, but we can control how we do it. Talk to you soon. Age Better Podcast is a proud member of the Sound Advice Network. Sound Advice, women's voices amplified.